misinformation often mimics science with data and documents and graphs to create some kind of credibility around it. But the main theme of misinformation is that it starts with the conclusion, while science starts with the questions. My name is Linda Karlsson. I'm a psychologist and a postdoc researcher at the University of Turku, at the psychology department and at the Turku Institute of Advanced Studies. Since 2017, I have been doing research on attitudes towards vaccines among both the public and among healthcare professionals, and also into what affects those attitudes. I've been involved in developing communication tools for healthcare professionals that they can use like as support when they discuss vaccines with patients who express some concerns around vaccinations or some misinformation about vaccines. The specific concerns that people have around vaccination are not necessarily directly related to misinformation always. People can have negative opinions about vaccinations being mandated, for example, or they can have a phobia for needles or concerns about the side effects that are mild, but then that can be caused by vaccines. But misinformation still plays a large role in the general erosion of trust in vaccines, and it also fuels people's concerns about vaccinations. And when it comes to anti-vaccination movements, they rely heavily on the spread of misinformation about vaccines for their purposes. And such misinformation often relates to vaccines not being safe, that they're not effective, that they cause quite dangerous illnesses, or that healthcare representatives and authorities are not trustworthy. And they often also promote alternative medication as more effective and focuses on more like anecdotal evidence and so forth. There are many ways in which science and scientific evidence are used in misleading ways to promote misinformation. One quite common technique is cherry picking. So that means like picking a small fragment of evidence or a single study that supports the point that one wants to make, while at the same time ignoring like the total body of evidence on that issue. And when picking the evidence, it's not relevant how good that evidence is or the quality of it or the context of it. It's all about the way that in which it can support the conclusions that you want to make. So this is of course a very unscientific way of forming opinions. Other techniques that are used in misinformation are using fake experts. And this is done to try to create some kind of credibility around what is being said. And these fake experts can be individuals with completely made up titles, or it can be individuals who are correctly presented as doctors or experts, but their expertise doesn't have anything to do with vaccination or the topic that they are commenting on. And then of course there are also individuals who are considered experts or have like authority within anti-vaccination movements, but their authority is built mainly on non-peer-reviewed content, such as web pages or books or podcasts and so forth. Another quite common theme in misinformation that is trying to sound scientific is to interpret causality where there actually is none. And that often relates to negative events that are said to be caused by vaccines, such as like severe illness or even death. But just because they happen after vaccination doesn't mean that they are caused by vaccination. And determining such causal links, of course, requires much more systematic approaches. And this is because a lot of things happen after we get vaccinated. They just naturally happen even without vaccines being the cause. So, for example, childhood vaccines are given at ages when developmental conditions are often detected, but that doesn't mean that it's the vaccine that are the cause of those. And disinformation messengers also often cite real and credible studies, but they misrepresent the findings. So they kind of tell just the partial truths in a way that fits their own narrative. And they can also often use preprints. So there hasn't been a quality check on those, and the methods can be flawed or the conclusions can be flawed, and that hasn't yet been detected. But disinformation messengers can treat these as having the same status as peer-reviewed research. And to those messengers, it doesn't really matter that the quality might be poor. What matters is that the conclusions of that non-peer-reviewed preprint is in line with the narrative that they want to put forward. And also, after the preprint maybe has gone through the process of review and the old conclusions have been revised and or even rejected, then the message of that preprint still lives on. So that also is a way in which the scientific process can be used to create misinformation. In general, it's much quicker to produce false information than it is to produce correct information, and false information usually also spreads much faster in social media and creates more engagement in the sense that it creates more likes and following and so forth. So there's really an incentive for creating these false narratives. Also, misinformation often mimics science with data and documents and graphs to create some kind of credibility around it. But the main theme of misinformation is that it starts with the conclusion, while science starts with the questions. So if we think about the consequences that misinformation can have on individuals and their opinions, we know that misinformation is very hard to debunk. And this is because we as humans, we do not just take in information rationally and evaluate it in a rational manner. And if it's corrected, then we just correct it in our heads and it's done. Instead, we more often tend to believe what already fits what we already believe, and we search for information in a way that fits what we believe, and we reject information that doesn't fit. So we kind of select what we want to believe, and what fits with our values and worldviews, that's what we consider to be true. So just telling someone that something we believe or something they believe to be true might not actually be true will not be enough to just revise that piece of information, as long as it fits with what they want to believe about the world. And another reason for why it's quite hard to debunk misinformation is that even if we actually succeed in correcting that piece of misinformation and we accept that this piece of misinformation is not true, it can still continue to influence our behaviors and decisions. And this is known as the continued influence effect. And for vaccination, this means that if we have believed in a piece of misinformation, for example, that vaccines can overload our immune system, and we learn that then later to be untrue, and we accept that to be untrue, we might still remain with that feeling that vaccines are unsafe. So, and that feeling of unsafeness is likely to then also affect our decisions about future vaccinations. So the consequences of misinformation within vaccination is that something that we see right now is that vaccine hesitancy is increasing and vaccination rates are on the decline. For example, we have epidemics of measles in Europe and in the US that have been like more controlled before, but that are now again rising. And this is not because of lower access to vaccination, because in these countries people should have access to the measles vaccines. So it's basically can be attributed to also increased hesitancy towards vaccines, which is fueled by misinformation. So we have actual like epidemics and consequences for people's health resulting from this.